I want to talk to you today about something that quietly worries a great many older adults, often more than they let on, because of the fear of what it might mean. Losing your train of thought. You're partway through a sentence and suddenly lose the thread of what you were saying. You walk into a room and can't remember why you came. A word is right on the tip of your tongue but won't come. You lose your place in a task or forget what you were about to do. And for many people, each of these little lapses brings a flicker of fear, a worry that it's the beginning of dementia, that their mind is slipping away. So today I want to do something genuinely useful and, I hope, reassuring. I want to help you understand what's normal and what isn't when it comes to these everyday lapses of thought and memory. Because here's the truth I want you to hold on to from the start. A great deal of this, the lost train of thought, the tip of the tongue word, the walking into a room forgetfulness, is a normal part of aging and of how the brain works, and is not a sign of dementia. Understanding the difference between these ordinary lapses and the changes that genuinely warrant attention can lift an enormous weight of unnecessary fear while helping you know when something is worth checking. And I'll keep this calm and balanced because most of this is normal, and the goal is understanding and reassurance, not alarm. Let me start with why these lapses happen and why so much of it is normal, because understanding it is genuinely reassuring. Your brain is doing an extraordinary amount at every moment, holding thoughts, retrieving words and memories, filtering distractions, juggling tasks, and a few things about this naturally change with age in ways that produce exactly these everyday lapses, without meaning anything is wrong. Our processing speed, how quickly we think and retrieve information, tends to slow somewhat with age, so it takes a little longer to find a word or a memory, which is why words sit on the tip of the tongue and thoughts take a moment longer to surface. This is normal. Our ability to juggle several things at once and to hold a train of thought against distractions becomes a bit more vulnerable, so an interruption or a competing thought can more easily knock us off track, which is why we lose our train of thought or forget why we came into a room, often because something distracted us in between. This is normal. Retrieving names and words specifically becomes a bit harder. The common tip of the tongue experience, this is normal. And our memory for where we put things or what we were about to do can lapse with distraction. This is normal. So a great deal of everyday forgetfulness and lost thoughts comes from the normal age-related slowing of processing, the greater vulnerability to distraction, and the ordinary glitches of a busy brain. And importantly, these happen to people of all ages, just a bit more with age, and they are not signs of dementia. Understanding that these lapses are a normal part of how the aging brain works is genuinely reassuring. Let me reassure you further by being clear about what normal age-related forgetfulness looks like, because recognizing its character eases a lot of worry. Normal, ordinary lapses tend to have a certain character. They're things like occasionally forgetting a name or word but remembering it later, sometimes losing your train of thought or forgetting why you came into a room, occasionally misplacing things but being able to retrace your steps and find them, needing a bit longer to learn or recall things, and being more easily distracted, while, crucially, you're still able to function well in your daily life, manage your affairs, learn new things, and the lapses are an annoyance rather than something that disrupts your life or that others find alarming. Importantly, with normal age-related lapses, you're usually aware of them yourself. You notice and are bothered by the tip of the tongue word or the forgotten errand, and that very awareness is itself somewhat reassuring. So normal age-related forgetfulness is occasional, doesn't seriously disrupt your ability to function and live independently, often comes with awareness of the lapses, and is more frustrating than disabling. This is the kind of thing the great majority of older adults experience, and it is not dementia. Recognizing this character in your own everyday lapses can reassure you that what you're experiencing is very likely the ordinary forgetfulness of a normal aging brain. Now let me be honest and clear about what kinds of changes are more concerning and do warrant attention, because the goal is not false reassurance, but helping you tell normal from worth checking, and there are differences that matter. While I want to reassure you about ordinary lapses, certain patterns are more concerning and warrant seeing a doctor, because they could indicate something beyond normal aging, whether dementia or, importantly, another treatable cause. More concerning signs include memory loss that disrupts daily life, like forgetting important recent events, appointments, or information much more than occasionally, and not recalling them later. Difficulty doing familiar tasks that you've always managed, like handling money, following a recipe, or managing medications. Getting confused about time or place, like losing track of the date or season, or becoming disoriented in familiar places. Difficulty with words and conversation beyond the occasional tip of the tongue, like frequently struggling to follow or join conversations or using wrong words, misplacing things and being unable to retrace steps, or putting things in odd places. Poor judgment or decision-making that's a change from before. Withdrawal from activities, and changes in mood or personality. And, importantly, a key difference is often that with more concerning changes, it may be others who notice the problem more than the person themselves, and the changes are getting worse over time and are disrupting the person's ability to function and live independently rather than being occasional annoyances. So the more concerning pattern is memory and thinking problems that disrupt daily life and the ability to function, that represent a clear change and are worsening, that affect familiar tasks, words, judgment, and orientation, and that others notice. That pattern warrants seeing a doctor, in contrast to the occasional, non-disabling, self-noticed lapses of normal aging. Let me say something genuinely important and hopeful about those more concerning changes, because even when something beyond normal aging is going on, it is very often not dementia and is frequently treatable. This is crucial. Many things other than dementia can cause memory and thinking problems in older adults, and a great number of them are treatable and reversible. As I've discussed elsewhere, an underactive thyroid can cause sluggish thinking and poor memory and is very treatable. Depression can impair memory and concentration significantly, sometimes mimicking dementia, and is treatable. Vitamin deficiencies, like B12, can affect thinking and are treatable. Medications and their side effects or interactions are a very common cause of confusion and memory problems in older adults, and are often adjustable. Poor sleep, as I've discussed, impairs memory and thinking. Infections, even ones like urinary infections, can cause confusion in older adults. Dehydration, other medical conditions, alcohol, and stress and anxiety can all affect memory and thinking. So if you or others notice more concerning memory or thinking changes, please don't assume it's dementia and despair, because it's very often one of these other treatable causes, which is exactly why seeing a doctor matters, to identify and treat any reversible cause. And even when it is a form of dementia, there's value in early diagnosis, in identifying treatable contributing factors, in support and planning, and in some cases, treatments that help. So the message about concerning changes is hopeful. They warrant seeing a doctor precisely because the cause is so often treatable, not because the worst is inevitable. So let me be clear about what to do, because the path is reassuring and sensible. For the ordinary, occasional lapses, the lost train of thought, the tip of the tongue word, the walking into a room forgetfulness, that don't disrupt your daily functioning, understand that these are very likely the normal forgetfulness of a healthy aging brain, and be reassured, while perhaps using some of the practical memory aids I'll mention. See your doctor if you have the more concerning pattern, memory, or thinking problems that disrupt your daily life and ability to function, that represent a clear change and are worsening, that affect familiar tasks, words, judgment, or orientation, or that others are noticing and concerned about, because that warrants evaluation, both to identify and treat any reversible cause, an underactive thyroid, depression, a vitamin deficiency, medications, poor sleep, an infection, and to assess what's going on and access support. Also see your doctor if you're genuinely worried, even about ordinary lapses, because reassurance and a check are reasonable and you needn't carry the worry alone. And if memory or confusion comes on suddenly, see a doctor promptly, as sudden confusion can signal an acute treatable problem, as I've discussed. The doctor can assess your memory and thinking, review your medications, check for treatable causes with examination and tests, and guide you. So be reassured about ordinary lapses. See your doctor about the more concerning, disruptive, worsening pattern, or if genuinely worried, and seek prompt care for sudden confusion. The reassuring message is that ordinary lapses are normal, and concerning changes very often have treatable causes. Let me give you some practical things that genuinely help your memory and thinking, because there's a lot you can do to support your brain, whatever your situation. First, use practical memory aids without embarrassment. Calendars, lists, notes, reminders, a consistent place for keys and glasses, pill organizers, and routines all genuinely help everyone manage everyday forgetfulness, and using them is sensible, not a sign of failing. Second, reduce distraction and do one thing at a time, since much lost train of thought comes from juggling and distraction. So focusing on one thing and pausing to fix something in mind helps. Third, support your brain through the well-established healthy brain measures, which genuinely matter. Stay physically active, since exercise benefits the brain. Stay mentally engaged with reading, puzzles, learning, and interests. Stay socially connected, since social engagement supports cognition, as I've discussed. Eat well, get good sleep, which is genuinely important for memory, and manage conditions like blood pressure, diabetes, and hearing, since these affect brain health, and treating hearing loss in particular, as I've discussed, supports staying engaged. Fourth, manage stress, since stress and anxiety impair memory and concentration. And fifth, address the treatable contributors, good sleep, reviewing medications, treating low mood, since these so affect thinking. So practical memory aids, reducing distraction, the healthy brain measures of activity, mental engagement, social connection, good diet and sleep, and managing health, plus managing stress and treatable contributors, all genuinely support your memory and thinking. These help everyone, and they're worth doing regardless. Let me paint you a picture of how this so often goes, because it captures the reassurance. Picture a man in his 70s who keeps losing his train of thought mid-sentence, forgetting why he walked into rooms, and grasping for words that sit on the tip of his tongue, and who has been quietly terrified that this is the start of dementia. Lying awake worrying, watching himself anxiously for every lapse. He learns what you're learning today, and understands that these particular lapses, the lost thread, the tip of the tongue word, the walking into a room forgetfulness, are the ordinary forgetfulness of a normal aging brain, that he functions perfectly well in his daily life, manages his affairs, and is aware of and bothered by the lapses, all of which fit normal aging rather than dementia, and the relief is enormous. He starts using lists and routines, reduces his multitasking, stays active and engaged and social, and sleeps better, and his lapses become less bothersome, and his fear lifts. And because he'd been worried, he mentions it to his doctor, who reassures him after a check. That's the common, reassuring case. Now in a different version, if someone had the more concerning pattern, disruptive, worsening memory problems affecting daily function that others noticed, seeing the doctor would lead to evaluation, very often finding a treatable cause like a thyroid problem, depression, a vitamin deficiency, or a medication effect, or, if it were dementia, to early diagnosis and support. In every version, understanding the difference replaced fear with knowledge and appropriate action. That's exactly what I hope this gives you. And let me speak directly to those of you caring for or close to an older person, because memory worries cause a lot of fear, and you can help bring understanding and appropriate care. If a loved one is experiencing or worried about everyday lapses, the lost train of thought, tip of the tongue words, walking into a room forgetfulness, you can help reassure them that a great deal of this is the normal forgetfulness of a healthy aging brain, especially when they function well in daily life, manage their affairs, and are aware of the lapses, which is genuinely reassuring and not dementia. At the same time, be aware of the more concerning pattern, memory or thinking problems that disrupt daily functioning, represent a clear worsening change, affect familiar tasks, words, judgment or orientation, and that you or others notice and gently encourage a doctor's visit for that, emphasizing the hopeful point that such changes very often have treatable causes: an underactive thyroid, depression, vitamin deficiencies, medications, poor sleep, infections, rather than necessarily being dementia, so it's well worth getting checked. You can support the healthy brain measures, activity, mental engagement, social connection, good diet and sleep, managing health and hearing, and help with practical memory aids and reducing distraction. And know that sudden confusion warrants prompt care. Helping a loved one understand the difference between normal lapses and concerning changes replaces fear with knowledge, brings reassurance for the ordinary, and ensures that concerning changes get checked for their often treatable causes. Let me draw this all together. Losing your train of thought, along with tip-of-the-tongue words and walking into a room forgetfulness, worries many older adults, but a great deal of it is the normal forgetfulness of a healthy aging brain, arising from the natural slowing of processing speed, greater vulnerability to distraction, and the ordinary glitches of a busy brain, and is not a sign of dementia. Normal age-related lapses are occasional, don't seriously disrupt your ability to function and live independently, often come with awareness of the lapses, and are more frustrating than disabling. More concerning and warranting seeing a doctor are memory and thinking problems that disrupt daily life and functioning, represent a clear worsening change, affect familiar tasks, words, judgment, or orientation, and are often noticed by others. But, crucially and hopefully, such concerning changes very often have treatable causes: an underactive thyroid, depression, vitamin deficiencies, medications, poor sleep, infections, and others, rather than necessarily being dementia, which is exactly why seeing a doctor matters. So be reassured about ordinary lapses, see your doctor about the disruptive worsening pattern, or if genuinely worried, and seek prompt care for sudden confusion. And support your memory and thinking with practical aids, reducing distraction, and the healthy brain measures of activity, mental engagement, social connection, good diet and sleep, and managing your health. So here's what I'll leave you with. First, understand and be reassured that a great deal of everyday forgetfulness, the lost train of thought, the tip-of-the-tongue word, the walking into a room forgetfulness, is the normal forgetfulness of a healthy aging brain, from the natural slowing of processing and greater distractibility, and is not a sign of dementia, especially when you still function well in daily life and are aware of the lapses. Second, recognize the more concerning pattern that warrants seeing a doctor: memory or thinking problems that disrupt your daily life and ability to function, that are a clear worsening change, that affect familiar tasks, words, judgment, or orientation, or that others are noticing and concerned about. Third, hold on to the hopeful truth that such concerning changes very often have treatable causes: an underactive thyroid, depression, vitamin deficiencies, medications, poor sleep, infections, and others, rather than necessarily being dementia, so getting them checked is well worth it to find and treat any reversible cause. Fourth, support your memory and thinking with practical aids like lists, calendars, routines, and consistent places for things, with reducing distraction and doing one thing at a time, and with the healthy brain measures, staying physically active, mentally engaged, and socially connected, eating well, getting good sleep, and managing your health and hearing. And fifth, see your doctor if you have the concerning pattern. If you're genuinely worried even about ordinary lapses, or, promptly, if confusion comes on suddenly. Most everyday lapses of thought and memory are the ordinary workings of a normal aging brain, not dementia. So understanding the difference can lift a great weight of unnecessary fear, while knowing when to get checked and that concerning changes are so often treatable, ensures you get help when it's needed. So take care of yourself, be reassured about the ordinary lapses, support your brain, and get the concerning, disruptive, worsening changes checked. And because distinguishing normal aging from other causes and identifying treatable causes require a doctor, please treat the more concerning pattern, or your genuine worry, as your reason to see your own physician, who can assess and help, rather than as a substitute for that care. And this discussion is for understanding and reassurance, not a diagnosis of your own situation.